Thank you for tuning in to Docs and Boxed. Make sure you guys like this video and subscribe to our channel so that more people can get the content that you love. Enjoy!
Hello, welcome to, I think this is the 7th episode of the Docs and Boxed podcast. I'm with Dr. Sorivel Sosa Hilario. Can you just introduce yourself with your name, job, education, the basics?
Okay, thank you for inviting me. I'm Sorivel Sosa from Dominican Republic. I'm a medical doctor from a university here, Universidad Autónoma de Santo Domingo. Then when I finished med school, I went to Spain. I did an MBA. And after that, I started taking class of research. And now I'm really working, combining this medicine, administrative things, and research.
That's cool. So I wanted to start with your job with the Global Health Leaders. So can you sort of explain what the organization is about and why their overall mission statement was something that you were drawn to?
Okay, I'm working with Global Health Leader since a year ago, and this is an organization who works with research and working with young people that have experience with research. And the mission of the organization is to bring people to start creating experience in this type of things. And we have two modalities of working. One is virtual, the one that we have the opportunity to meet in the last couple of months. And the other is a student come to Dominican Republic and they go to the visit the hospital and see and bring in experience with the community.
Mm-hmm. So cool. Yeah. So with your specific role, you're a research advisor, right, for the high school and college internships. And I thought it was fascinating that you as a medical professional, you're choosing actively making the choice to work with younger students who aren't as polished or don't have as much experience. But with I don't know, I've kind of gotten the feeling that a lot of medical professionals are more closed off about their work or reluctant to give younger, dumber students opportunities to work with real clinical case data or work in their lab. So why do you believe that it's so important to give us young students these opportunities to work with real stuff, real stuff in the real world? And do you think that overall more people in medicine should be willing to give these eager students these opportunities?
Yes, to respond to this question, I have to go back. As a little girl, I want to be a teacher.
Okay.
I love teaching and having the opportunity to practice medicine, working on research, and teach is the main thing that I can do in my life. Mm-hmm. And giving the opportunity to young people, I think, is very rewarding because the knowledge, you don't get more knowledge without sharing with others. Mm-hmm. In other hands, you get richer when you share the knowledge with some people. And when you have the opportunity to put the young people in contact with research, you are giving tools so they can be more creative, they can build personal critical thinking and the stuff. That's why I think it's more important to start teaching as when you are younger, unless wait until you are at the university. For example, here in Dominican Republic, we've put in contact with research when we're finishing the grade. Mm-hmm. And you have lost 5-6 years of experience that you can have if you learn and you start taking program as GHL.
Mm-hmm. So for you, when you were younger, were you able to access opportunities like the ones that Global Health Leaders gives? Or is that something you only had access to later? And do you wish that you had it earlier, and how do you think that would have impacted your career?
Yeah, I think the thing that I'm learning now, after I became a doctor, for example, we start working with research at university when we are in 5th years, almost finishing. And imagine the opportunity that you have since this age, start learning about research. You can have more experience when we are able to go for grants for young people.
Mhm.
I learned that when I was like 25.
Yeah.
And this opportunity are until 30, only 5 years. And imagine you can have 10 or 12 years opportunity for start doing grants for young people.
Yeah. So yeah, with the like I don't know, like I mentioned, I think a lot of other professionals are more reluctant to give these kind of opportunities. So can you as a medical professional, can you give insight into why they might be like more closed off to this? And do you think that they should start trying to change their perspective a little bit?
I think that people doesn't do that on purpose. I think it's for they don't know. They are not aware of that.
Mhm.
I think this is the reason. We can find some people that think, oh, I prefer to have my own knowledge and I don't want to lose time with this type of young people. But I don't think that is the most people. I
Mhm.
think uh, they definitely they are unaware of that.
Mhm. That's cool. So, you're also a general manager of Kaiman, I think. So, can you talk about that role and sort of why you decided to pursue an MBA and get involved with the business side of healthcare? And I don't know, because you also have an MD, right? So, why was getting that degree in business something that was important to you?
Okay, as this podcast is created for young people, I have to talk a little bit about my history, my personal life. I studied medicine, then I gained a scholarship to study a master in Spain.
Mhm.
I didn't go to Spain to complete the MBA. I went to do a master in psychology. But when I was there, they told me, oh, you're in a psychology, you're a doctor, you can complete this program because this and this and that requirement. And I remember a psychiatrist that told me, oh, if I were John, I would like to have experience in managing,
Mhm.
combining health and managing. And oh, okay, and I take this advice, and that's why I complete the MBA. Doing that, that changed my life, that increased my critical thinking, my creativity, all the thing, and open new opportunities to start working in projects. And that's in when I come back to Dominican Republic, I start working in projects with community,
Mhm.
people living with HIV, and I have this experience because I had this manager and a medical doctor, and that's why I start this journey. Then I finished working in this place with people living with HIV and have the opportunity to get into CAIME.
Mhm.
This position was open, and as I have the background, I went into the interview and got the job. And it's amazing because I can combine all the things that I love to do.
Mhm.
I what it says, teaching, doing things for the population with low income, um, research, and in this position as the manager, I can work with those topics. I love leadership too, and I can apply all my knowledge in this position. That's why I feel very comfortable being in this position.
Mhm. So, like, as the general manager, would you say most of your duties are more related to business, or do you still have the opportunity to, I don't know, like, be a clinician for some patient or do some research on the side? Or
Yes, I have the opportunity to combine both. My
Mhm.
main role is the manager, but I have time during the day to be in the with the patients.
Mhm. Have you ever explored like the idea of doing a private practice because you say that you really like the business and then you also really like the healthcare. So private practice is another way that I think a lot of people try to combine those interests. So is that something that you ever explored?
Yes, I have a personal project that is called Conversatorio In,
Mhm.
and in a few years ago, I'm planning to do something with this project, combining patients, giving health, doing another program similar to research and that stuff.
Can you talk more about conversatorial in? What is that? And like, what do you hope to do with that?
Okay, actually, this project is a little bit sleepy, but I imagine Conversatorio in as a big company working with people like you, young people, giving advice about career, saying, oh, look, this program is available. You can start research, you can combine leadership, you can be work with this type of AI, for example. And actually, I had a podcast too
Mhm.
that I started in 2019, I think.
Mhm.
As a
Mhm.
I have the opportunity, oh, let me explore this. And in this podcast, we talk about leadership and I share basically my day by day.
Mhm. That's cool. So with like the podcast and then this and stuff, so it seems like you have a lot of your own side projects and stuff. So how do you manage to balance your time between like your jobs with Global Health Leaders, KaiMed, and then also have the time to do these like side projects and stuff?
Okay. Time management is something very important so we can achieve our goals.
Mhm.
I try to put, okay, I work in Keme since 8 to 5.
Mhm.
And then the rest of the time, I have from 5 to 7 or 8. For example, one day for GHL, another day for the university class and those projects. And after that, family time. And Saturday and Sunday, family time too, because it's very important for me.
Mhm. So I know a lot of people are kind of concerned about going into careers in medicine because it seems as if like, oh, the hours are really long, the education is really long. I'm not going to get much time to do my own stuff. So, what do you think it is about your specific roles and like your specific careers that have enabled you to have the time for this kind of stuff? And then how do you recommend, like young people like me trying to go into medicine, how do you recommend that we sort of make time for that?
Okay. At the beginning, when we're in the faculty and the first time doing the medical internship, it's very time consuming. You have to keep in mind that you need so much time for your life to dedicate to this goal. But after we finish this, I think we can manage the time. For example, when I was in med school, I couldn't have a job. I was, Daddy, give me money because I have to go to university from 7 a.m. till 10 p.m. And taking, as I'm from Dominican Republic, and as you can see, my English is not native. I have to go to class too. And if you want to practice any sport, it's important to dedicate this time. So you have to keep in mind that I'm gonna sacrifice this period of my life, but then I'm gonna be able to take these results that we take in those years of life. And I recommend don't take this decision, this choice about your life, oh, because it's too long, because at the end, the time pass.
Mhm. Yeah. So you mentioned being from the Dominican Republic, and obviously it's not as privileged of an area as like the United States or something. So how do you think your upbringing in that area shaped your interest in the future? Because I think you mentioned some of your research interests are more about like health disparities, community health. So why is that important to you? And can you walk me through some of your work in this area?
Okay. As I mentioned before, I like to combine
Mhm.
research, health disparity, and teaching.
Mhm.
And I think here in Dominican Republic, we have a gap to complete with this work. And working with company as GHL, we can do this collaboration to increase this gap. And if you can ask me, what can you do in life with this type of thing that you're working actually? I can say that and imagine that in 5, 7 years, for example, I will be able to change life.
Mhm.
How? Teaching people.
Mhm.
Because I only can, for example, access to 5 or 10 patients per day. But if I'm here from 5 to 7 years teaching people like you,
Mhm.
you have the opportunity to see 10 patients, another 10, and it will be more rewarding than only doing by myself.
Mhm. So speaking of teaching, you had I think, a stint with the Harvard's School of Public Health. So what program were you teaching there, and how does that tie into your love for teaching people, helping people grow?
Okay, I'm part of PPCR family, as we say when we complete this program. This is a program about research. It's called Principles and Practice of Clinical Research by THCH Chan School from Harvard. It's a program we can take in at Boston in the university, or we can take it virtual. I complete the program in a mix. I take class here in Dominican Republic and tuition in health company that provide this service. And we went to Boston like 2 times.
Mhm.
And to the program, we went to Brazil. This program, it lasts 9 months. We have class every week for synchronic hours, and then we have many projects to complete during the week. And this program is very rich because we have the opportunity to take class with different people around the world. For example, I have friends from Brazil, United States, Africa, Japan that I met virtually in
Mhm.
this program. And at the end, we have the opportunity to go during a whole week to put in practice the thing that we learn in this couple of months. And when we finish the program, you have the option to apply for be a teaching assistant.
Mhm.
And then I complete the program in 2021. And then in 2022, I applied to be a teacher assistant. And as a teacher assistant, we collaborate with the students that are currently in the program. If they have any question, completing the task, giving advice during the project, we have to complete 2 projects in this program. And it's amazing because you are connecting with people around the world with different belief, but everybody interested in research. For example, we have a group with 200 people around the world. And if somebody is working in one topic in research, oh, I'm working in this and I need that. Somebody's interest. I'm moving from Dominican Republic to Brazil, for example. I'm searching for a job. Do you have any opportunity available? And that's amazing
Mhm.
that you can have from this course.
So obviously, where you taught, Harvard is like a very prestigious university. And given, I guess, sort of the pressure that a lot of younger students face in trying to get into one of the top tier, more prestigious universities, with your experience in Harvard in like a program there, how do you think that that value or that pressure is misplaced? And do you think that an education from like a place like Harvard is actually like significantly more valuable than an education somewhere else?
Well, personally, I think that you can be the best in workplace, but we need to recognize that when you go to a prestige school, that give you some points when you are trying to take a step in life. For example, if somebody see my CV, my curriculum, they say, "Oh, you went to Harvard." It doesn't matter that I went to Nebrija in Spain, that is well known as a business university, but as soon as they say Harvard, this call attention. So it's a plus.
Mhm.
But I think that we don't have to keep in mind, oh, I need to do this and go to this program because the prestige, because I think we are able to be good, whatever. It's about the disponibility that us, own person, we have.
Mhm. Do you think, in addition to obviously having that on your resume or your CV, do you think that there's any other sort of more hidden like pluses or benefits that a place like Harvard has? Like you mentioned, the networking. Is there anything else like that that stands
The
out to
networking, I think the networking is the best part.
you? Really? Okay.
Yes, the network. Because in my experience, having this opportunity to connect with people around the world, that opens opportunity. For example, I have a partner from this program that he used to live in Brazil, and he moved to England because he knew somebody in this program.
Yeah.
And that's the opportunity.
Yeah. Do you have anything else you want to share? I think I've hit all that I wanted to talk to you about today.
Okay. If somebody is watching this video, the main thing, the main idea that I want that you keep from this conversation is that we're able to reach whatever we want. I never have the idea to complete a program in Harvard. That was an opportunity to come out because I was trying to be good in my partner. My first thing was like, how am I gonna to complete a program in English with if I have my whole life studying English and my parents paying class and I don't have the fluency, but I quit this idea from my head. And I remember in July 2021, I was in front of all my partners and my teachers speaking English in Harvard. So everybody had the opportunity to reach whatever we put on mind. Just we need to work for that.
Yeah. That was awesome. It's great to hear that. It was great talking to you. This is the end of the episode, so have a great rest of your day. Thank you.
Thank you. Bye-bye.
Bye.